Meet Adela. Adela lives in a rural village in a Mesoamerican country. To visit her health center, she travels long distances on foot, by bus, or even by boat. On some occasions, the health center lacks the necessary personnel, inputs, or processes to take care for Adela with the quality that she deserves. Let's think of all the processes that have to be performed correctly, over and over, to ensure that every woman like Adela that goes to each health center receives the quality care she needs. Have the traditional result-based financing models been able to improve these processes to provide response to Adela's needs? The Salud Mesoamerica Initiative has shown they are not sufficient. Only with a correct combination of incentives, government ownership, leveraging financial resources, external measurements, and technical support can achieve both results in health and a better system performance. This is the Result-Based Financing Plus formula. We wanted to work with the countries in Mesoamerica to achieve the health targets established for 2015. National averages showed positive outcomes in health, but looking closely revealed equity gaps for the poorest 20%, for more than 1.8 million women and children in Mesoamerica just like Adela. We knew that there were health interventions that were effective to reduce this gap, and we started to design ways to speed up the achievements of outcomes. This forced us to answer old questions with new answers. How to introduce sustainable innovations, how to speed up the individual and organizational changes of health systems, how to facilitate government ownership of changes and the capacity to maintain them. What local changes are required to rapidly reach those most excluded populations? We built a partnership based on trust and respect. Countries contribute with leadership and policies as well as economic resources. Cooperating partners contribute capital and experience. IDB facilitates, providing technical support and offering a platform for policy dialogue. The Institute for Health Metrics and Evaluation provides external and independent verification of the goals agreed with the countries. 5 years later, the results speak for themselves. Early prenatal care increased by 31% in Nicaragua. Institutional delivery coverage in Honduras went up by 23%. Early postpartum control grew by 81% in Belize. The quality of these services also improved substantially. In Honduras, Nicaragua, and Belize, management of obstetric complications according to international standards increased between 17% and 61%. In El Salvador, prenatal care quality improved by 24%. The most vulnerable boys and girls in the region have also benefited. In El Salvador, measles, mumps, and rubella vaccination coverage increased by 39% amongst children ages 12 to 23 months. 95% of children sick with diarrhea are treated with zinc in Belize and Honduras. The management of infections, prematurity, and asphyxia amongst newborns, according to international standards, increased by 30 percentage points in Honduras. Important progress has likewise been achieved in reproductive health matters. In El Salvador, the use of family planning methods went from 53% to 75%, which represents an increase of 22 percentage points in 5 years. How have we achieved this? With a results-based financing plus model, donors contribute 50% of the capital and the remaining 50% is contributed by the country. If the country meets the negotiated goals, it receives an award equivalent to 50% of the original contribution. Governments may freely invest this money in the health sector. Experience has shown us that there are gaps between result-based financing theory and implementation of the projects on the ground. Establishing an incentive and rule of the game are necessary. Reducing health inequities with a results-based financing model in Mesoamerican countries has required adding a plus. Salud Mesoamerica Initiative contributes this plus. We seek to improve health systems performance, and most importantly, the Mesoamerican governments lead and institutionalize these changes. Therefore, Salud Mesoamerica Initiative is more than a result-based financing program. It is a plus program aimed at effectively reducing health gaps suffered by the most vulnerable. A plus initiative that works, generates results, and helps Adela and her family to have access to the health they need and deserve.